about is what you can do naturally to decrease cholesterol plaque. Well, for a long time, in actually all of my medical books and all of my medical literature, it has said to us that you can't decrease cholesterol plaque at all. And even if you get on a statin, which is one of those pravastatin, rosuvastatin, atorvastatin, otherwise known as Pravachol, Crestor, Lipitor, Simvastatin, that you couldn't decrease your cholesterol. Now there's a place for those medications, and by all means, if you're on them, don't stop any medications without talking with your physician or coming to see us. But I'm here to tell you, there are so many things that we can do naturally to decrease your cholesterol plaque. And yes, I'm talking about the cholesterol plaque that's already sitting in there. We used to think once it was set in stone, it was set, well, not so much anymore. So for the stable plaque that's sitting, that is kind of embedded itself into the arterial wall, yes, those might be hard to decrease, slim down, or remove. However, there's unstable plaque, which is much more dangerous plaque, and there's plaque that's up and coming that we can prevent from gluing itself to the arterial wall. That's the plaque that we want to address. That's the plaque that we want to talk about today. And did you know? Of course, I'm going to tell you about the natural ways to do it, and there are studies behind this. This isn't just something that we think might work. There are studies behind this. So let's dive right onto it. So what will we do? Well, diet-wise. Diet-wise, we're always going to avoid the butters, avoid the heavy creams, avoid the sauces, avoid the heavy ranch dressings, and actually most salad dressings. Please make your own or do none at all. The vegetables are lovely and taste wonderful just the way they are, or maybe with a little bit of lemon or a little vinegar and oil, or nothing at all. In addition to that, what can we do naturally to promote a decrease in cholesterol plaque? Well, there's studies up and coming, and a lot of them are international studies, and showing we can make progression in this. So number one, first and foremost, the almighty garlic. We gotta love this guy. This guy chases off vampires. He does so many things in life, and in addition to that, he decreases cholesterol plaque, proven in studies. We're going to put the studies up on our website and on our YouTube channel so that you can see that this guy is the greatest guy in your herb cabinet. Use him often, use him all the time, because aged garlic will absolutely decrease your cholesterol plaque. It's almost like magic, so why not? It's an herb, and it can do so much to help your body. So let's do it. Garlic's so easy to add to anything that we do. We have studies that shows it decreases high blood pressure, it decreases diabetes, it decreases sclerotic vessels, meaning sclerosis or stiffening of the arterial vessels, which lead to heart attack and stroke. It decreases cholesterol and coronary artery disease progression. So why wouldn't you load up on garlic? Just make sure your mate eats some too, and it's a happy family. All is well. So love the garlic. Pycnogenol. Pycnogenol is gotten from pine bark. No, none of us want to go suck on a tree, but pine bark and pine nuts. So you can get those anywhere now. You used to have to go to specialty stores to get these things. Not anymore. Pine bark, pine nuts, Pycnogenol, and that's in one of our specialty supplements called Pine Stat. Is wonderful, absolutely wonderful to decrease cholesterol and cholesterol progression. So those are two really, really simple things. Let's go to the third simple thing. Nattokinase. Well, what is nattokinase? If you've heard me talk, you know I do not like soybeans, soy sauce, edamame, or anything to do with soy or tofu. Yes, it's a protein, but it's a bad protein. It disrupts your thyroid hormones, and it disrupts male and female hormones. So why would we want to use it? We really wouldn't. In some countries, it's a staple because it's a cheap plant, or it's an economical plant, I guess would be a better way of saying it, that is easily grown in countries that may not have a lot of livestock or seafoods or plants or whatever. But by and large, soybeans are not good for us, except I have to make note tonight in the nattokinase form. Well, what is the nattokinase form? When you take, for example, cabbage and you make it sauerkraut, you have taken it from the cabbage plant version to a different version, and that version has prebiotics, probiotics, and all of these wonderful things because you fermented it. And fermentation has taken it to a probiotic type of food. Same thing with soybeans. Are they good for you on a regular basis? No. Is cabbage? Yes. However, when you take those soybeans and you ferment them and you make nattokinase, it's exceptionally great for you. It has been shown that over 6,000 FU units per day, which is pretty hard to get. You'd have to do a lot of supplements, but they actually did a study and it decreased carotid plaque by 36%. In that study, they studied it against a statin. That's the medication a lot of my cholesterol clients are on, and a lot of you are on, and that cholesterol medication was simvastatin, otherwise known as brand name Zocor. Is it a bad medication? No. Is it a good standard cholesterol medication? Yeah, it's not the one I use, but it's a good standard medication. But what is the point here? Do you mean to tell me if I eat a fermented food in high doses, or I supplement with that fermented food extracted into a supplement, that I can decrease my cholesterol plaque by 36%? And Big Pharma can only decrease it by 11%? This is not Dr. Burkenstock's words. This is in a study. Text message me, email us, info@skinbodyhealth.com. We'll send it to you. We're going to publish it on our YouTube channel and our website so that you can see it for yourself. It's just increasingly interesting to me how all the big pharma drugs have natural things right in the background that can help us and not cost us whatever hundreds of dollars per month and have all the side effects. Okay, I digress. Oh, before I forget, we all know I'm Dr. Burkenstock, Skin Body Health. We have a store, skinbodyhealth.com. You can go to store.skinbodyhealth.com or just go to our website, skinbodyhealth.com. Scroll down into store. And we have a cholesterol defense bundle. We hope you will take advantage of it. It's very good, and we have the FDA approved supplements that have the GMP. They are secure, and exactly what's on the label is what's in the product. That's what you want, because when you go to a grocery store or a GNC or a vitamin shop, if they're not a GMP certified vitamin, you can be getting chalk, and what's not much on the label might not be anything at all that's in the product. As long as it doesn't hurt you, it's acceptable, because vitamins are considered as a food. If you don't have the GMP seal of approval, which we do, we are proud to present potent supplements that do you well. And you know how we prove it? Because with our clients, we draw your blood when we first meet you, and then we draw it every 3 to 4 months or so thereafter. And we can see the changes that are happening as we put our supplements on board. Not just generic supplements, but for where you might have deficiencies. And then you feel better, you look better, your vitality is increased, and voila, the blood work looks better. It's just a magical potpourri, isn't it? So the cholesterol defense bundle is Omega Pure Bright, which is fish oil. I'll talk about that in a moment. And it's high EPA, DHA, high potency, high quality grade fish oil. It's not motor oil. That's what you can get down the street. It's fish oil with a high 800 milligram active ingredients that's going to help not only your cholesterol plaque, but decrease your ADD symptoms and so much more. So Omega Pure Bright fish oil, number one. Number two, vitamin D, K1, K2. K2 has studies proven to decrease cholesterol plaque progression in the coronary arteries, carotid arteries, and the cerebral arteries. So what is the instrument that gets K2 in the blood? Well, it's vitamin D, K1. So vitamin D, K1, K2. It's a syrup and it's delightful. It tastes like honey. Magnesium Pure Night. Magnesium counteracts coronary artery calcification. Does so many other things for us. And last but not least, Sugar Smart. Well, Sugar Smart, we're talking about cholesterol. Why am I talking about sugar? Sugar. Because Sugar Smart has the main ingredient, berberine. Berberine has been proven not only to decrease sugar, but also to decrease high density LDL, triglycerides, and lipoprotein B. So the lipoproteins go down, the good cholesterol goes up. That's what is the magic of berberine, which is in our Sugar Smart. So the four elements are Omega Pure Bright fish oil, vitamin D, K1, K2, Magnesium Night, which has got 3 types of elemental magnesium, high potency magnesium, and Sugar Smart, which has got high doses of berberine, amongst other great things, including cinnamon, that is great for cholesterol. That bundle normally retails for $265. And throughout March 1st, this bundle, Cholesterol Defense Bundle, is going to be $159. Let's decrease your plaque. Let's get that cholesterol plaque down. We can do it together. We can absolutely do it together. So let me return to where we were. We talked about Pycnogenol. That's gotten from pine bark. We do have a product called Pine Stat. You can also get that from pine nuts. Pine nuts are found in a lot of teas, and you can actually get those at the grocery store and put them into your teas, your salads, your smoothies, and get some pine bark and pine nuts in there. It will cause a regressive arterial plaque. It has absolutely been studied, in a 2015 study it proved such. Berberine, at least 500 milligrams a day. That would be in our Sugar Smart product. The berberine decreased plaque in a study by 3.2% when it was studied over a year. So this isn't taking a vitamin and saying, well, it might help me stop accumulating cholesterol plaque. This is also saying the cholesterol that's already there, we're decreasing it. And we can't even show that demonstratively with the statins that are on the market. We can prevent more plaque. We can get the LDL numbers down, which we are going to follow. It's a smart thing to follow. But what about the plaque that's already there? Now, it's not a magic pill. It's not a magic muscle. But all of these things help. And I don't know about you, but I would much rather take a multitude of vitamins and have my blood work improve, my carotid scores improve, and my overall health improve than taking a strong, big pharma medication that can hurt my body and cause me a lot of money. So I did talk about nattokinase, which is found in the fermented soybeans known as natto. You can get those at a lot of your sushi restaurants. You can also find those in Asian grocery stores as well. You can even find it online. There's a Boston manufacturer that will send you 6 little jars at a time of the nattokinase. So a couple ways to get that. Vitamin K, we talked about that. Decreases plaque regression. It's absolutely amazing. Don't forget about vitamin K. It's so great for your skin, bone health, and other things as well. Vitamin K, the often overlooked vitamin, but the very necessary vitamin, and it does great things for coronary artery disease and plaque digression or plaque decrease. Magnesium. Magnesium counteracts coronary artery disease. There are studies that show us that we have increased regression, meaning backup, of coronary calcification, meaning cholesterol plaque buildup, and when the body has a deficiency of magnesium. Well, let's flip the target. When we increase magnesium, there are studies in 2024 that says increased magnesium has been proven during the studies, controlled versus patients that took magnesium versus patients that took placebo, which was a sugar pill they thought was magnesium. It decreased inflammation. It decreases carotid intima. Carotid intima, when the carotid intima thickens and gets out of alignment, we get disease, and then we get thrombosis and plaques that can give us a heart attack and stroke. Also decreases heart attack and stroke, proven in the study that was done in 2024. We're going to get to fish oil last but not least in a moment. Please don't forget to like and share us. We always appreciate when you listen to our webinars, and we want to help your friends and family get more information on the things that we know can help them improve their vitality and longevity. If you've missed any of our previous webinars, we've been on YouTube for many years. Dr. Burkenstock, Skin Body Health. That's Dr. Burkenstock YouTube channel, Dr. Skin Body Health. If you're watching from YouTube and Instagram, welcome. Like and share us to be entered in our drawing for tonight. So for tonight, we will be getting a complimentary vitamin D K1, K2 for the first 5 people who like and share. Got to hit that share and subscribe button. And we'll be happy to send you out a vitamin K, D1, K2. We'd love to help you and your longevity. We'd like to get you on the path to better health. So, again, our bundle tonight is Cholesterol Defense Bundle. Normally retails for $265. Tonight and throughout March 1st, these 4 products, Omega Pure, which is the high medical grade EPA, DHEA fish oil, magnesium, which has got your 3 types of elemental magnesium, your vitamin D, K1, K2, and last but not least, your Sugar Smart with high doses of berberine and other assets for not only your sugar but your cholesterol health. So this bundle normally goes for $264. It's on special for $159 through March 1st. We'll hope you take advantage of it. We welcome you to be a client. We'd love to bring you in, have a consultation. We'll get blood work on you. Let's see where you are today. Let's start you on some of our program and see where you are in 3 months. I guarantee you, you'll be feeling better, looking better, and your blood work will be much, much cleaner in the result. I'm Dr. Burkenstock from Skin Body Health. It's been a pleasure talking with you tonight.